name is Christopher Self, and I would like to get you guys all ready for the enhanced skills training. This is for anaphylaxis with IM, epinephrine, adrenaline administration. This training is authorized by the North Dakota Department of Health. And to complete this training, not only do you have to take the lecture that we're going to do this evening, but you also have to complete the actual hands-on training. The hands-on portion of it is being able to see that you can actually do the required skills. And there's also a written test that you must take. So we're going to do the lecture portion of it. So our objectives is with successful completion of this training module, the advanced EMT, EMR, or EMT will be able to describe and correctly demonstrate expected baseline education, which includes signs and symptoms of anaphylaxis, epinephrine identification as a medication, the mechanism of action and effects of epinephrine. We're going to talk about steps in aseptic technique, the preparation of EPI for IM administration, and for IM administration of EPI. There's all your resources. So the earliest reported case of anaphylaxis can be traced to approximately 3300 BC when the Egyptian king Menenses died from a Hymenoptera sting. So Hymenoptera is going to be the stings of insects such as sawflies, wasps, bees, and ants. So according to Rosin's Emergency Medicine Edition, chapter 119, is going to be edition 2. Anaphylaxis is derived from the Greek, which ana means against. Phylax means to guard or protect. So really what the meaning of anaphylaxis means, against protection. So there's about 100,000 attacks per year in the United States. 60,000 are first-time events. But the scary thing is 1,000 to 1,500 of these are fatal. All right, Rosins again says that primary triggers for food include eggs, peanuts, tree, nut, milk, fruit, shellfish, shrimp, and crustaceans. Medications, a lot of antibiotics include penicillin, cephalosporin, sulfonamides. All of those things that we see right there can cause or common causes of anaphylaxis. And of course, the big one there is going to be insect stings, which are going to be Hymenoptera venoms, fire ant stings, natural rubber latex. In 1/3 of a case, a trigger can't even be established. True anaphylaxis is the involvement of two systems, at least two systems, after an allergen exposure. And this could include your skin, mucosa, rash, or swelling. You can have respiratory distress, hypotension, which is going to be low blood pressure, GI upset, and cramps. We really don't think too much about that so much with anaphylaxis, but it is true. Or low systolic blood pressure after the exposure to an allergen. All right, so take a look here. It says age 1 month to a year, less than 70. Age 1 to 10 is less than 70 plus 2 times the age. Age 11 to 17 is less than 90, and adults are less than 90, more than 30%, or a more than 30% decrease from their baseline. Anaphylaxis is treated with epinephrine. Epinephrine is the drug of choice when it comes to anaphylaxis. So we want to make sure that we are giving epi and giving it early. And here's the reasons why. So we have to get an emphasis on giving epi is because a lot of times epinephrine is not given in enough time or may not even be given at all. All right. So look at all of these different studies in journals. Epinephrine for anaphylaxis underutilized and underavailable, requires prompt epinephrine shot. Over and over again, it's saying that epinephrine is just not being utilized like it needs to. So let's take a look at some of the key terms that we're going to go over today. So anaphylaxis is a life-threatening hypersensitivity reaction of the immune system. All right, it means that the immune system has just really gone nuts and is just, instead of trying to help, it has actually made things a lot worse. Aseptic technique is a procedure performed under sterile conditions. Asphyxia is suffocation as a result of blockage of the airway. Dyspnea is labored or difficulty breathing. Also a term that is used as well as shortness of breath. And okay, epinephrine is a hormone released from the adrenal glands that activates several tissues in the fight or flight response. We're going to talk about that in just a second. Histamine, one of several chemical messengers related from immune cells that promote inflammation as a defense mechanism. Intramuscular, also known as IM, is a medication route by injection into the belly of a muscle, which encourages rapid transport into the bloodstream. Shock is severe reduction in blood pressure by any cause that results in inadequate blood flow, oxygen, and glucose to the tissues. There are 6 rights of medication administration. The first thing is, do we have the right patient? All right. Make sure that we're giving this to the right patient. Do we have the right medication? We need to get our medication out and look at it and see, is this the medication that I want to give the patient? Am I giving them the right dose? Am I giving it the right route? Am I giving it the right way that the medication needs to be given? Is it the right time to give the medication and the right documentation? And we're going to talk a lot about documentation here shortly. Here's what's scary. Half of the people with EpiPens don't know why or how to use them. That's kind of scary. People walk around with these things and going, I don't know why I have it, but the doctor said I needed it, so here it is. So epinephrine is a synthetic form of the naturally occurring hormone epinephrine. It's in your body. It is released during the fight or flight response, and it is a reflex stimulation of the adrenal gland. So what happens? Ever get scared and all of a sudden your heart's racing and everything, your pupils dilate, and you feel like you're ready to flee out the door? And what that is that's epinephrine that's being given to you. It is a sympathetic division of the autonomic nervous system. During fight or flight reaction, the airways dilate or constrict. What do you guys think? They do dilate. The body's stress response causes a normal release of epinephrine to maintain homeostasis during vigorous activity. The same actions of epinephrine counteract the bronchoconstriction and low blood pressure of anaphylaxis when administered by medical personnel. So the first thing is your airway dilates. It gets very big, so it allows more air to come in, so you get more oxygen. That way you can run away or fight. Blood flow to skeletal muscle increases, your pupils dilate, your blood sugar level increases, your heart rate increases, blood pressure goes up, and your breathing rate. It's getting you everything that you need to be able to either run or to fight. It's all of the stuff that you're going to need to be able to basically a survival response. So epinephrine is definitely underused in EMS, and one of the things is, I remember when I first got started in EMS, is that they were always scared that we were going to give epi for a allergic reaction versus anaphylaxis. And the thing is a lot of times, because we were so scared that we were going to give it because it was a mild reaction, is that more severe reactions were not being treated. So I want you guys to understand today is to, if you think you need epinephrine, then you use epinephrine. There is no contraindication for epinephrine for anaphylaxis or anaphylactic shock. This is the primary medication for allergic reaction and anaphylaxis in children as well. So let's take a look at some of the examples of our friend epinephrine. So there's different names of the medicine. So a lot of folks have the EpiPens, and you can see that we have the adult EpiPen on top, and the green box is going to be the EpiPen Junior. The only difference between these two is going to be the dosage. We'll talk about dosages in just a second. Up here in your right upper hand corner there, you're going to see that that is an ampule of Epi 1 to 1000. And then right below it is going to be a little bottle there of adrenaline. Adrenaline is also Epi. All right, the concentration is going to be 1 to 1000 or 1 milligram to 1 milliliter. There should be an expiration date that's found on the container. So the indications for use is anaphylaxis with respiratory distress or anaphylaxis shock. So is this a different dose than when using the EpiPen? And the answer is no. It is the exact same dose. The adult dosage here, guys, is going to be 0.30 milligrams, 0.30. For pediatrics, it's going to be half of that dose, and it's going to be 0.15. So again, let's take a look at our EpiPen dosage. Adults 0.30 and pediatrics 0.15. The same dosage schedule is used in anaphylaxis no matter the method of IM administration, whether we use an EpiPen or we actually draw the medication up. So anaphylaxis is an overreaction of the immune system. All right, what happens is we can have sudden severe allergic reaction involving the whole body, more than just a local reaction like a sting or a rash. So most common allergens are going to be insect stings, food, medications, latex. The skin can have a response with itching, hives, and swelling. You can have a vascular response with tachycardia, hypotension, and hypoperfusion and shock. Tracheal and bronchial swelling may result in asphyxia. That's why it's so important to give epi and to give epi early. So there's a question here. What respiratory signs would be typical of anaphylaxis? So one of the big ones that we can see is going to be wheezing. We can hear that, the tightness and everything. We can have dyspnea, that shortness of breath where it feels like they're tightening down. Here we go. So respiratory signs and symptoms. We can have shortness of breath, swelling and or spasms, rapid or labored breathing with those use of those accessory muscles, prolonged expiration, hypoventilation, decreased lung sounds, changes in the ability to speak. Once we're getting into the upper airway stuff, we start seeing hoarseness, stridor, which is that really high-pitched sound that we see in the upper airway, wheezing, which is going to be that lower airway, or other abnormal sounds of breathing. So the action of epinephrine, let's see how this stuff works. It relaxes smooth muscle in the airways. It counteracts that histamine and other cytokines, raises blood sugar level, raises heart rate, blood pressure, and myocardial oxygen demand. So epinephrine is that fight or flight response. What it's going to do is it's going to help us to survive this reaction by giving us all of those good things that we need. For intramuscular injection of epinephrine, the onset of effect is about 3 to 5 minutes, 3 to 5 minutes, and the duration is about 1 to 4 hours. So it may take a minute or two for this stuff to work. Just hang tight. Here are some side effects of epinephrine that will occur. These are going to be completely normal. So if you have these, don't freak out. It's going to be just fine. As palpitations, because epinephrine does cause that. You can have tachycardia and sometimes some dysrhythmias, hypertension, headache, tremor, which is a huge one, weakness. Skin signs can be pallor or sweating. Some folks can have a little nausea and vomiting, nervousness and anxiety, pain or redness at the injection site. All of these are perfectly okay after we give epinephrine. So which vital signs are important to document before and after administering epinephrine? One of the big ones is going to be blood pressure, but one of the things that you really want to look at, let's take a look right here. Because epinephrine is expected to cause widespread changes in function, it is important to frequently monitor and document vital signs, which includes heart rate, respiratory rate and effort, blood pressure, pre and post medication. They include the general appearance of the patient, their work of breathing, their lung sounds, skin signs, and of course, their ability to be able to speak. So techniques of medication administration. So let's take a look at a couple of things that we're going to need to get going here. So we're going to need a transfer device, which is a filter needle or straw for an ampule, as we're going to be able to have equipment to be able to draw the medication up. A blunt transfer device for the vial, 1 milliliter syringe, not larger. All right, we don't want to get like a huge syringe. We just need one that's 1 milliliter. 23 gauge, 1.25 inch safety injection needle. Those are adequate for both adults and peds. For the safety, the device are used on the medication container and the needle is only used on the patient. We're going to talk a little more about that in just a second. So let's talk about preparing ampules and vials. So first, let's take a difference between ampules and vials. So epinephrine has to be stored away from light. Leave it in its carton until ready to use. Also keep away from extreme heat and danger of freezing. So all of our folks that may be watching this that are from outside agencies and different things, you need to make sure that you have your medications need to be temperature controlled, not just in the winter, but in the summer as well. That they need to be stored in such a manner that when you look at the manufacturer's recommendations on there, that those medications are being stored within those temperature controls. All right, so an ampule, as you can see, looks like a little vial. All right, you'll see that it has a little vial there, and it kind of tapers off at the top, and it has a scored neck. All right, a vial is just a little bottle, and it has a self-sealing rubber top, and we're going to talk about the differences here in just a second. So epinephrine, after being exposed to sunlight for various times, take a look at these pictures here. All right, so if we expose the medication to sunlight and extreme temperatures, it can cause the destruction of that medication. All right, let's take a look at how to obtain medication from a glass ampule. All right, so confirm the medication. Take a look and make sure that the medication name is indeed epinephrine, that the dosage is either 1 to 1,000 or 1 milligram to 1 milliliter. Make sure that the expiration date, that it's within the date, that it has not expired, that it's not cloudy, there's no color, and there's no precipitate, there's nothing cloudy or anything that looks different. It should look nice and clear. So hold the ampule upright and tap its top, all right, to dislodge any trap solution down to the bottom of the vial. You need to get a, you can either get a, and you can either use gauze or an alcohol pad wrap, all right, and not the alcohol swab itself, but the outside container. Use the thumb to break along the scored edge of the neck. Place the gauze or alcohol pad wrap around the neck to protect the thumb. So what you're going to do is protect your thumb with that pad, and then press the top, and you'll see that it'll score. Be very careful. There is glass that's right there, and it can cut your thumb if you're not careful, and it'll look a little like that. So make sure that you're using the technique that we just looked at. All right. And we're also going to talk about when drawing this up, because there can be the potential for glass shards in there. Anytime you're going to be using an ampule, you want to make sure that you are drawing the medication up with a filter needle. For our folks at Metro, these are going to be the green needles. Those are filtered needles. Please make sure you're using it for those medications. All right, so this is how our technique is we're going to tap the bottle. Wrap, snap, and then draw. Tap, wrap, snap, and draw. All right, so here's how we are going to draw up our medication. So from an ampule, hold upright between the thumb and the fingers, just like in the picture there. May invert to ensure all medication is in the lower section of the ampule. Like I said, it does require a filter needle straw to retain glass to make sure that we're not getting any glass fragments. You don't have to draw air into the syringe or inject air into the ampule before drawing up the medications. It's an open system, so you don't have to place any air or anything into it. So you just simply draw the medication up. So as we're drawing the medication up, as you can see right there, as we're drawing the medication, all right, using a syringe, insert the filter needle in the ampule and draw the plunger back until you reach the correct dosage. And again, the correct dosage for an adult is 0.3 milliliters, and for peds is 0.15. And you can see that right there on the needle that the top one is going to be the peds dose, and the bottom one is going to be the adult dose. All right, now let's take a look at how to obtain medication from a vial. So a vial is that little bottle, it's got the top on it. And again, we take a look at our medication name, make sure it's the correct medication that we're wanting to give, because some of these vials can look very similar. We want to make sure we're giving the correct med. The dosage should be 1 to 1,000 or 1 milligram to 1 milliliter. Make sure that the medication is in date. that it's not cloudy, there's no color or precipitate in the medication. Clean. Okay, so we're going to pop the top. We want to clean the vial's rubber top with an alcohol swab. We get that nice and clean using our aseptic technique. So we're going to prepare the syringe with the needle cap on, pull back the plunger to the appropriate dosage. All right, so if we're going to give, for an example, we want to give 0.30 for the adult dose, we're going to pull back 0.30, and we're going to inject the same volume of air into the vial as you withdraw the medication. So whatever we're going to take out of that vial is what we're going to push in with air. So inject the air and withdraw the medication. So you see that we've got the vial turned upside down. We insert the transfer device through the rubber stopper. We inject a volume of air slightly greater than the volume of medication to be withdrawn. Draw the medication from the vial. All right, so now we have the medication drawn up, and we see it's exact same way we did with the other one. All right, so we have 0.3 at the bottom for the adults, and we have 0.15 at the top for the kiddos. Now we're going to have to select a site for where we're going to give this medication. And all of these, the medication that we are going to be doing with epinephrine is going to be given intramuscular. So intramuscular sites allow a drug to be injected into the belly of a muscle so that the blood vessel supplying that muscles can distribute that medication to its site of action via the bloodstream. So the first step, we have to prep the site with an approved antiseptic by scrubbing vigorously and allowing it to dry. So once we've prepped the site with our alcohol, all right, so we're rubbing it on the skin, do not touch, blow on the site or fan the injection site, all right? We just scrub it. Align the needle above the injection site at a 90-degree angle to help ensure IM administration of a drug. If you can't figure out what 90 degrees is, 90 degrees is straight up and down. All right, so what PPE should be worn when preparing the medication and injection site? You should make sure that you have on gloves. All right, you should also make sure that you have on goggles or some kind of eye protection as well, because there is a, it is an injection, so be very, very careful. But, whatever PPE that you think that you're going to need, make sure you have it with you. All right, so here we go. EMS provider safety, always use standard precautions. Gloves for standard precautions, alcohol or providine iodine swabs. Syringe of the proper size with proper graduations. Needles or filter straws are also required. Never recap contaminated needles. Most needle stick accidents happen due to trying to recap them. And dispose of your sharps in a biohazard container. So our primary intramuscular injection site is going to be the primary lateral thigh. So if you're sitting right there, take a look and find your primary lateral thigh. Really easy to find. So just imagine that as you're sitting, it's going to be right there on the outside of your thigh, and you can feel that nice big muscle right there. That's where we're going to inject that. Our secondary, and it's not the preferred place, is going to be the deltoid. All right, the deltoid is going to be found right here where your arm connects up at the shoulder, and it's going to be that nice rounded muscle right there at the top, your deltoid. So where is the best IM injection site for infants and toddlers? Let's take a look. So the anterolateral thigh is the best site for infants and toddlers. So as you can see, it's going to be right there on top of the leg. All right. Good site for all ages, but especially under 3 years old. It's far from major blood vessels and nerves, and pretty easy to get at for those little ones as well. All right, you can see how they're holding their child right there and got the legs nice and tightened down. Real easy to grab a hold of those kids that way. Insert the needle again at a 90. All right, so prepare the site. Scrub the skin vigorously with an alcohol or iodine wipe. Allow to air dry. Do not touch, blow on, or fan the injection site. Just put it on there, make sure it's clean, and we're good to go. So an intramuscular injection is given at a 90 degree angle. All right, so you can see here we have we're trying to get into the muscle. So how much longer will it take to treat anaphylaxis if epinephrine is administered too shallowly rather than in muscle? Let's take a look. It may take twice as long, up to 10 minutes, for epinephrine to have a life-saving effect if not injected in the muscle. That's why it's so important to give it at a 90. You know, that patient may not have that 10 minutes if you give this medication incorrectly. So make sure you're giving it nice at a 90 degrees. So our IM injection technique, and we're going to go over this in class. Your IM injection depth for an adult is the lateral thigh is 12 millimeters, which is about a ½ inch. The deltoid is about 13, and again, they're both about a ½ inch in. All right. Here's the thing, folks. We don't need to bury the hub or the needle. All right. Over 200 pounds, you may need deeper penetration to get through some subcutaneous tissue, some fat and different things. But we want to just make sure that we're getting into the muscle and getting the medication where it needs to go. All right, so hold the syringe in your dominant hand and then remove the needle cover. Stabilize the injection site with your non-dominant hand using the pinch technique, which we're going to look at. All right, stretch technique does work better for those obese patients. Holding the syringe like a dart, quickly but not forcefully, insert the needle into the injection site at a 90-degree angle until the proper depth is reached. Release the skin while continuing to hold the syringe in place with the dominant hand. Grasp the plunger with one hand of the barrel of the device with the other. Pull back, which is known as aspirating. All right, and wait 5 seconds. If no blood comes into the syringe, proceed with the injection. Slowly depress the plunger to administer the injection. A slow, steady injection rate allows the muscle to distend gradually and helps to accept the medication under minimal pressure. Once the medication has been administered, make sure you wait 10 seconds. Then withdraw the needle using appropriate safety features and or activating the needle safety engineering device. All right, if blood is present when aspirating, if we pulled back and we see there's some blood in there, withdraw the needle and discard the medication. Start over with the new medication and a new site. It means you're going to switch legs. So once we've given our injection, cover the injection site with an alcohol or gauze pad and apply gentle pressure to the area to help reduce pain, and also it helps to improve some absorption of the medication. Properly dispose of the syringe and needle assembly in an appropriate sharps container. Place a bandage over the injection site. All right, we'll be doing the skills section later. So make sure, just like this, make sure you insert that needle at that 90-degree angle. Broadly hold the muscle. Do not pinch the skin. Don't pinch the skin up. Just hold the muscle. Hold the syringe like a dart. Insert the needle with a quick stab at a 90-degree angle to the skin surface, just like we're seeing there. Deliver the medication. Draw back the plunger to verify you're not in a blood vessel. Again, if blood is present, take it out. Depress the plunger with a slow, steady motion until we've given all of the medication. Remove the syringe needle utilizing safety needle mechanism. All right. We don't want to be trying to recap needles or anything. We want to place them immediately into the sharps container. Never, ever recap needles. Massage with gauze or alcohol, wipe to enhance absorption, and it's a little more comforting as well. Cover the puncture site. Reassess your patient and prepare for transport. So when we reassess our patient, let's check out their level of consciousness, their appearance. Let's see how they're doing. Is their respiratory distress? Is it improved? Let's take another set of vital signs and change in symptoms. So we have to treat and document all information concerning the patient and that medication. Make sure we're checking for airway, breathing, circulation, loss of consciousness, oxygen therapy. We want to make sure that we're taking a look for indications for the medication administration. We want to make sure that we are rechecking their vital signs, their work of breathing, lung sounds, skin signs, the ability to speak. Has it improved? Has it gotten worse? We want to document our medication, our dosage, and the delivery side, and the response to the medication. They get better or worse, and then reassess all of those vital signs again. We want to make sure that we are documenting both positive and negative responses. So document the patient's response to the treatment, all right? Their level of consciousness, their behavior, breathing, lung sounds, skin sounds, vital signs, and changes in ability to speak. Document adverse effects, if any. So how long does it take for the drug to take effect, and what do I do if the patient does not improve? Well, if the patient has not had any significant improvement within 10 minutes, consider a second dose. And this happens sometimes. We had a patient not too long ago that was in severe anaphylaxis and did not have improvement with our first epinephrine. We gave a second dose and the patient began to improve. So sometimes you have to give that second dose. Second dose may require consultation with online medical control according to your local protocols. Always follow your local protocols, please. If unable to contact medical control or ambulance, it is recommended that the EMT, advanced EMT EMR, may administer the second dose if required. Thorough documentation is essential. When you need to give EPI, give EPI. So let's take a case example here. This is going to be a lot of fun. Here we go. So you're called to the house of a 5-year-old male with a chief complaint of this tongue itching. Pop tells you that about 30 minutes prior to arrival, the patient ate an oatmeal raisin energy bar, and within minutes of eating the bar, he developed itching of his tongue and a sore throat. He then developed scattered hives, followed by an episode of vomiting. All right, so let's take a look. Ooh, goodness. Physical exam shows a diffuse red rash, facial swelling, rapid breathing, faint wheezing, and mild diffuse abdominal tenderness. His vital signs are heart rate 124, respiratory rate of 24. SpO2 is 94%, blood pressure is 64/34. His temp is about 98.8. During the exam, his oxygen sat dropped to 89%, and his mental status began to decline. All right, the child was immediately placed in the supine position. Oxygen was administered via non-rebreather mask. Epinephrine, because this is a child dose, 0.15 milligrams administered to his left anterolateral thigh. And we gave that right as the transport ambulance arrives. The ambulance crew went ahead and started an IV line. They gave a 20 milliliter per kilogram bolus of 0.9 normal saline, and they also gave albuterol as well. So within 15 minutes, his rash began to improve and the wheezing was no longer heard. We did some repeat vitals there, and his heart rate's 96, respiratory rate 18, pulse oximetry reading of 97%. His blood pressure is now much improved at 110/59. His mental status returned to baseline. All right, and we can see that his previous vital signs, he's had significant change in his vital signs on the improvement. He did not require any additional doses of epi and was observed in the ED for about 5 hours. He was discharged in good condition with an auto-injector device and a referral to an allergist. All right, guys. So if you have any questions, discussions, or anything after watching this video, I hope that you guys feel free to go ahead and give me a shout, be able to answer this. And remember, this is just the didactic portion. You still have to take the skills testing and also the written exam to be able to pass this module. Any questions or anything, please give me a shout. I'm more than happy to help. All right. And the release of training liability statement. This PowerPoint is intended to provide examples of tried and proven techniques of caring of patients with the various injuries or illnesses that EMS personnel will encounter in the field. It does not provide the only method or technique that may be an acceptable approach in caring for an injury or illness. However, since the various certification examinations used within the state are based on the current edition of this document, as well as the current edition of the National EMS Education Standards, this should be considered a companion to the curricula used for the education of EMS personnel.